Well, right now I'd like to welcome Brett Wertman. He is cardiologist and also the chief of service for Hoag's Cardiac Rehabilitation Center right up the road in Irvine. Pleasure to meet you.
Nice to meet you. Thanks for having me.
Yeah, it is great that that center is right up in Irvine. Fantastic. So a little bit about your background and what exactly is cardiac rehab? What does it encompass?
Cardiac rehab is essentially a gymnasium where heart patients, people who've had heart attacks, who've had heart surgery, who've had stents put in, or have chronic chest pain, are able to go and exercise in a supervised setting. There are nurses there. Many of them are veteran nurses who have worked in intensive care units. They also have exercise physiologists who supervise the exercise. Patients do treadmills, arm ergometry, some light weightlifting. They're attached to heart monitors, and it is a graduated process where they start slowly and kind of ramp up and get their strength back, and it also accelerates the healing process.
Okay, so obviously these are the type of people that benefit from it. The people who have heart attacks or as you said, may have stents put in and things like that. It sounds like a really great setting where they're not going to overdo it. They're going to do just enough.
Just enough. It starts very slow, and it also kind of gives comfort to the patient knowing that someone's there to watch them.
Yeah.
They're hooked up to a heart monitor. They can kind of know what their limits are, start slow and ramp it up, and then it allows them, after they graduate from the program, to go out on their own and exercise and feel comfortable doing what they need to do.
Let me ask you something that's sort of on that same theme, since you're a cardiologist, and that is exercise in general for people who maybe are of a certain age or maybe have had some sort of medical conditions. Maybe not exactly heart conditions, but overall they're might be overweight, and maybe they start out doing too much too soon. Every once in a while you hear about people who are out on long hikes or something like that. Is it wise to, if you're starting an exercise program, you haven't been exercising a lot, maybe for years, to see your physician first so they can at least look at you, check you out, and see, are you healthy enough to do this type of exercise?
I think that's a very important point. If you haven't exercised for a long time, it may be important to consult with your physician. Oftentimes we see patients in the office and kind of assess their overall risk for heart disease. Do they have high cholesterol? Do they have a family history of heart disease, namely heart attack in a family member at an early age? Blood pressure, diabetes, smoking history, that type of stuff. If they do, and if they have any symptoms, fatigue, or just feel like they're out of shape, a lot of times we'll put them on a treadmill in the office just to kind of assess their overall risk. Once we've kind of made sure everything's okay, the general recommendation is it doesn't take a lot. You basically only need to do moderate exercise, that is to say, walking at a moderate pace, just enough so you can break a little bit of a sweat, maybe tackling some light hills. That's all you really need to stay in shape from a heart standpoint. You don't have to go sprinting or running on a treadmill or anything like that.
Okay. Now, as far as the center that you have over there, how do people come about using the center? Is this something that would first they have to come and see maybe their primary care, or somebody who has had some sort of heart surgery with Hoag? How would that work for most people?
It's open to anyone. It's a physician prescribed program, so a lot of the people that utilize the gym are people who have been hospitalized and have had a heart attack, had a stent put in, or have had open heart surgery. You don't have to go through the hospital to qualify, though. If you talk to your physician and you've had any one of those conditions, they can simply write the prescription and get you set up to go.
Okay. Now, what about it being covered? Is it something that it's out of pocket for the patient, or how would that work?
It's for all the conditions that we talked about. Medicare and most commercial payers pay for it. So if you've had a heart attack, if you've had a stent put in, if you've had valve or bypass surgery, chronic chest pain from blocked arteries, if you have chronic angina, and then a small category would be people who have had heart transplants or lung transplants. They also are covered.
Okay, so as you said, this is actually prescribed, so therefore it can be covered.
Correct.
What are some of the apparatus that you have there?
Most of it is treadmills. We have,
Okay.
again, the arm ergometer. There's some light weights. There's the recumbent bicycle. That's the most of it.
Okay. Once someone is put on this routine, how often would they go, or does it just depend on the type of rehabilitation that they're going to need?
It's usually a total of 36 sessions, and people can go
Okay.
as often as they want. Usually people are going 2 to 3 times a week, up to 36 sessions. And then after that, you can continue to go. Sometimes they do charge a nominal fee out of pocket if you want to continue to use it as a gym, but Medicare will pay the full 36 sessions, and that's usually all it takes to get back into shape.
Oh, that's great.
Yeah.
Yeah, that's really good. Now, with the folks that are monitoring them, do they come when they come in each day? Are are blood pressure checked and things like that before they start?
Absolutely. Blood pressure is monitored throughout the duration of exercise. They're hooked up to a telemetry or heart monitor to monitor the heart rhythm to make sure there's no arrhythmias or anything. And then there's a nurse or an exercise physiologist basically asking how you're doing, how do you feel, taking a number of assessments.
That's fantastic. Yeah, it sounds like a great program. How long has it been open over there?
We've been going since July. Hoag Health Center Irvine had its grand opening about 2 weeks ago now.
Okay.
But the rehab unit has been going since July. It's brand new, state-of-the-art equipment, really nice.
That's fantastic. And it's on Sand Canyon, am I right?
Sand Canyon and Alton.
Okay, very good. I have a local number over there. It's 949-276-2446. But as the doctor said, this is something that you would check with your own doctor, your own primary care.
Correct.
And they would know about this program that they could sign up for?
They would. Again, if there's any questions, they can give us a call over at Hoag, and we can facilitate that process.
That's fantastic. It sounds like a great program.
Yeah, it really makes a difference.
Yeah, definitely. Great to have you on. It's
Thank
been a
you.
pleasure.
Nice to meet
Nice
you.
to meet you.
Thank you very much.
It's Dr. Brett Wertman, and he is the Chief of Service for Hoag Cardiac Rehabilitation right up here in Irvine off Sand Canyon. The number is 949-276-2446. And if you think it's something that could benefit you, I would suggest to look into it. It sounds like a great program. Nice to meet you.
Nice to meet you.
We'll be right back. Very good.